For my next PowerPoint, I chose to do Chapter 24, Infectious Diseases Manifesting in the Genitourinary System. This is a very important system for our bodies. It controls a lot of important things. So first we'll kind of talk about those anatomical features. For the female and the male, almost everything is the same, just the female contains the uterus. There is some differences in the female and male urethra. We'll go into that a little bit more in the next slides. So with the female tract, we have our kidneys. These filter waste. They maintain our fluid balance. They're responsible for the production of erythropoietin, renin, and calcitrol. It also regulates our blood pressure and vitamin D. And then our bladder, it receives urine from the ureters and stores that urine. When it is signaled, it will release that urine outside the body via the urethra. Our uterus, this is where a fertilized egg will implant. It is also responsible for the menstrual cycle, where those epithelial cells will shed. And this is where a baby will grow until birth. Now, sometimes a baby may implant in the fallopian tubes, which is not ideal, and it will not make it there. Your baby has to implant in the uterus. And as we said, that urethra expels that urine through the opening to the outside of the body. A female urethra is shorter than a male. And the female urethra, as we noted, it's not kind of connected to the opening. It is connected, but it's not at the opening. So the reason women are more prone to UTIs is because it's a shorter travel for bacteria because the urethra is shorter. And here we have the male, which everything is the same. The kidneys do the same thing. The bladder does the same thing. Their urethra, it extends to the external environment of the body, longer than the female. And it not only allows for the passage of urine, but also the passage of semen. So, not a major difference, but definitely some differences. So, here we'll talk about those natural defenses of the female genitourinary tract. So, we have mucosal surfaces that contain antimicrobials for the first line of defense. So, those mucosal surfaces have those antimicrobials, and they will kind of help aid to stop in the passage of those bacteria. And then we have epithelial cells, and these provide secretions containing bactericidal and virucidal agents. Again, those will kill out those bacteria and viruses that try to pass on through. And then some natural defenses of the male. So they contain secretory IgA immunoglobulins, and these are present in the mucous membranes, and they will prevent the entry and spread of pathogens. Also, the flushing action of urine actually helps move those microorganisms out of the system. So, every time you, use the bathroom, you're just flushing that urethra out, flushing the bacteria out. the normal microbiota, it's kind of the same as most that are on the skin. So your urethra actually contains non-hemolytic streptococci, staphylococci, cranibacteria, and lactobacilli. And like we stated before, the urinary tract, that urethra, it regularly flushes those microbes out to kind of keep it at balance. Because if we have it overgrown, that's when we run into problems. So here's some common urinary tract infections. Well, maybe not all so common. We have cystitis, pyelonephritis, leptospirosis, and schistosomiasis. First, we'll talk about cystitis. So this is an infection of your bladder, and it almost always follows bacterial infection in the urine. So you get that bacterial infection in your urine, and it travels to the bladder. This is actually the most common type of UTI in women. Some signs include the urge to frequently urinate. You may feel like you have to urinate more often. You have pain or a burning sensation when you're urinating. Hematuria, which is blood in your urine. Pelvic discomfort and a pressure in your lower abdomen. An acute case kind of happens suddenly, but the chronic case kind of lasts for a longer term. Here we have pyelonephritis. So this is commonly called a kidney infection. Infection is caused by bacteria entering the urethra. So that bacteria enters that urethra and travels to the kidneys, causing the infection. So some signs and symptoms are a fever or chills. You may have nausea or vomiting. Typically, you'll have pain in your back, side, groin, or belly. You may have the urge to urinate more often. There may be an odor. Your urine may smell a little foul. And you could possibly see some blood or pus in the urine. The treatment will commonly involve antibiotics to kind of clear out that bacteria. Next, we have leptospirosis. This is obtained through infected animal urine. It's most common in those warm climates. Signs or symptoms include a high fever and headache, bleeding, muscle pain, red eyes, and vomiting. Typically treated with antibiotics, but if it is left untreated, it can actually cause kidney and liver damage. And last, we have schistosomiasis. So this is actually a parasitic worm infection, and it's not found in the United States, but it is found in sub-Saharan Africa, the Middle East, Southeast Asia, and the Caribbean. This happens when fresh water becomes contaminated with human or animal urine or feces. So these people are drinking this fresh water, or so they think it's fresh, and it's been contaminated. The parasites will actually penetrate human skin so they can enter the bloodstream. And from there, they will migrate to the liver, intestines, and other organs. Some signs and symptoms include a rash, itchy skin, fever and chills, or belly pain and joint pain. A medication is given for 1 to 2 days, and it will clear the infection. It's given to kind of kill out those parasites. So next we're going to talk about infective reproductive tract conditions. We have vaginitis, vaginosis, prostatitis, some genital discharge diseases, ulcer diseases, and wart diseases. So first we'll get into vaginitis. So this is just inflammation of the vagina, and it can result in discharge, itching, and pain. This may be caused by bacteria, yeast, viruses, or sometimes it can be just the chemicals in some cream or sprays or clothing. Some signs and symptoms include an unusual vaginal discharge. You may have itching or irritation. When you urinate, it may be painful. And it could be painful during intercourse. So if it's a yeast infection, it's generally a thick, white, odorless discharge. And if it's bacterial, it could be a grayish, foamy discharge, and it could have a fishy smell. So not really a good time. Next we have vaginosis. It is also called bacterial vaginosis, or BV. This happens when the normal bacteria, that microbiota, kind of grows too much, and it'll throw off the balance of the good and bad bacteria. So just overgrowth of bacteria. Often people show no symptoms, but they could have a gray, white, or green discharge, that fishy smell, an itchy vagina, or they could have burning with urination. So treatment often includes a gel or cream that is inserted into the vagina, or they may have to take oral medications. And here we have prostatitis. So this is actually swelling of the prostate that produces seminal fluid. Some things that may initiate this could be an infection or injury to the prostate, or the person may have an immune disorder. Symptoms usually include difficulty urinating because it's so swollen. They may have pain in the groin, pelvic area, or genitals. Prostatitis sometimes gets better on its own. This kind of goes away. But if not, then the doctor will prescribe antibiotics. Some genital discharge diseases. This is a mix of fluid and cells from the vagina, and it ranges from a whitish and sticky to clear and watery, and sometimes has an odor. Some examples are that BV, cervicitis, chlamydia, gonorrhea, the forgotten tampon, pelvic inflammatory disease, trichomonas, and vaginitis. And here we have genital ulcers. So this is raised and painful bumps on the skin of your genitals. It could be caused by chancroid, chlamydia, genital herpes, HIV, syphilis, and then sometimes it could be non-infectious ulcers like aphthous ulcers or Bates disease. And then genital warts disease. These are small bumps on the genitals or rectum. It's commonly caused by sexually transmitted infection. Can be caused by HPV. They can be either treated by medicine or surgically removed. There is a vaccine for HPV that can protect you from getting it, but there is no cure. That HPV vaccine, it can prevent infection by certain types of HPV infection. All HPV vaccines protect against HPV types 16 and 18. These cause the greatest risk of cervical cancer. This vaccine should be given around 11 or 12 years of age. Gardasil 9. It actually protects people ranging from ages 9 to 45. And last, we'll talk about group B streptococcus. So this is an infection caused by a common bacterium. It's usually harmless in adults, but it's often found in the urinary tract, digestive system, and reproductive tracts. It is dangerous in newborns and adults with chronic conditions like diabetes or liver disease. It may be passed from person to person through direct physical contact. Group B can be spread during delivery if the baby comes in contact with infected fluid. Serious GBS infections can be fatal, including bacteremia, sepsis, and pneumonia.